of you know that I fought hard to pass legislation that would expand the State Children's Health Insurance Program, or SCHIP. This legislation would have provided coverage for 10 million low-income children with an additional 80,900 in our state of Michigan. This election could offer a historic opportunity for our country to address this terrible situation and return to good health care for all.
Congressman, sir, you have acted in the chiefest of capacities, and I'd like to thank you for your tireless work to see to it that regular folks like me and my children and family have some kind of net to catch us in time of unforeseen trouble. Disease that we had fought for 3 years to get rid of was now done. But the lesson and the journey that I learned was there is no way to be prepared for the unseen. And something has to be put in place so that when you're sick, you're not just thrown off the boat. All to say that every time we're sick, it's a scary thing. Even the smallest of bugs or colds, I don't want it because I don't want to have to figure out how I'm going to take care of it. The idea that a national plan, something American needs to happen, I agree with you so much, sir, and I thank you. I thank you for having the wherewithal and the passion to fight for us. I'm not a mooch. I believe in giving back to my community, but I'm not a psychic, and I didn't know to be prepared for cancer and kidney disease. I watched so many parents stress. I educated myself, and I read, and I had a different avenue, a different experience. But there are so many people just like myself that just don't know where to go or what to do, and their daughters and sons didn't live like my daughter did. They didn't have the opportunities. I believe that we went through what we did so that we can speak out. We can help you speak out for those of us who want to be well, so that we too can add to the country's economy, so that we can keep it strong, so that we can hand down from generation to generation that belief that we are to take care of one another in brotherly love.
This will be one of the concerns we'll confront when we have the next administration, I hope, which will give us strong support for program national health insurance instead of the kind of miserable approach this administration has had, which I would observe seems to know the cost of everything and the value of nothing.